Dr. Carlos Del Rio now. He's the Executive Associate Dean and Distinguished Professor of Medicine at Emory University. Doctor, thank you for being here. I want to start first with news that we just got this evening. Colorado has become the first state to confirm a case of that mutated strain of coronavirus, the same one from the United Kingdom. How concerned are you about widespread contagion of this particular mutation?
Well, I think we're all concerned, but none of us is surprised. We knew this was going to be the case. And if you start doing sequencing, you're going to find the strains. I think what you also find is that this is a 20-year-old person with no history of travel. And if this person had no contact with anybody who's traveled to the UK, it clearly shows that this strain is already being transmitted in the US. So what we need is to ramp up. As we're ramping up vaccine, we also need to ramp up genomic sequencing in our country. We are way behind in genomic sequencing, and it's very important that we start doing that much more than we currently are.
When we look at the slower than expected rollout of the vaccines, Operation Warp Speed said, look, one of the problems is there's a lag time between the shots as they're administered and when it's being reported. Is that the only problem?
Well, I heard Admiral Brent Rohr, and I have a lot of respect for him. And let's say that, yes, indeed, 2.1 million is too low. Let's say that 4.2 million people have already received the vaccine. That still puts us way behind where we want it to be. We want it to be by the end of this year, which is only 2 days away, at 20 million vaccinations given. So, yes, our ramp up has been slow. We really need to change that dramatically. And if we're going to get to have every single American who needs a vaccine and wants a vaccine vaccinated by July, we need to start vaccinating about 3 million people a day. That is a huge effort, and it's going to require a major coordinating effort, and it's going to require funding. That's not going to happen without additional funding.
Okay, so how do we get there? I mean, has this got to be something that the federal government tackles?
Well, the federal government has to work with state governments, and everybody has to work together. This really requires federal government, state governments, private sector, public sector. It needs everybody to do their best to really have clinics open all the time, to have vaccination available. But, we have underfunded public health for years. And right now, it's really hard to find employees in public health that are not busy who can start doing the vaccination. And if you look at hospitals, also because of the surge in patients, nurses are busy, and you cannot have them, also be in the ICU and then go and vaccinate in the clinic. So you have a problem with personnel, you have a problem with staff. So we need to be creative. We need to come up with ways to get, medical students, nursing students, and others trained to start administering the vaccines, because if we don't do that, we're not going to reach our goals.
Shepard Smith here. Thanks for watching CNBC on YouTube.